Junior doctors across England have launched a 4-day strike over pay. Their walkout is likely to cause unprecedented disruption to the National Health Service. It's also the longest stoppage in a wave of strikes, which has seen nurses, ambulance crews and other health workers take industrial action. Lape Olarinoye has more.
Doctor retention!
A month on from the last walkout, junior doctors from across the UK have staged yet another strike, still demanding better pay.
Junior doctors have suffered a 26% pay cut since 2008. And we are not working any less than our colleagues were 15 years ago. If anything, we're working more, we're working harder, we're seeing more patients and we're seeing more unwell patients.
Education and health.
This strike is part of a bitter pay dispute in which the British Medical Association, a union which represents doctors in the UK, is demanding a 35% pay rise for its members. It said that increase would make up for 15 years of below-inflation wage rises, which has caused retention and a recruitment crisis. The government, on the other hand, says that figure is simply unaffordable.
We are ready to have discussions with them, but clearly a demand for 35%, over £20,000 for some junior doctors is not fair or reasonable.
The message from the junior doctors is clear. They say they want to be valued by their employer, the government. It's claimed the strike will cause severe disruptions to an already struggling healthcare system and could take the NHS weeks to recover from.
I'd be angry, and I think you've got to remember people are going to be waiting years and stuff like that for appointments, especially now with the big backlog, COVID and stuff like that. So people are going to be angry.
More than 250,000 appointments and operations could be cancelled, and up to half of planned treatment has been affected. Despite this, there's a strong support from the British public, including from those waiting for treatment.
I'm still alive, I'm still smiling. I'm with them, I support them.
We're losing doctors all the time because they're going for better paid jobs.
And we're just going down to hoots for them.
There are growing calls for more investment in wages by the UK government, which has made it harder to recruit junior doctors. Moreover, as a result of the static wages, many are leaving for other countries to continue their practice elsewhere.
So I get targeted ads all the time.
So can I ask you, as a doctor yourself, do you support the junior doctors' strike?
It's so regrettable and it's so unfortunate, but I do support the junior doctors' strike. This is a legitimate grievance that they have, and 98% of the junior doctors voted for this strike action, by the way.
I don't think anyone is a non-starter, and most people would imagine that doctors are already among the highest paid professionals in the country.
Let me put this into context for you. So they are trained, they train over 5 years, lots of university loans, and then they work extraordinarily hard, long hours with a lot of responsibility, and their pay distills down to about £14 per hour. That is absolutely unacceptable. Furthermore, this is not a "I want a pay rise." This is more a case of "I want my pay restored to what it should be, considering the 15 years of below inflation pay rises that they have had." So it's more a restoration. Furthermore, they are not asking for "give me my 35% immediately." They are saying we will accept a restoration of pay which is phased. And unfortunately, the Secretary of State for Health and Social Care has refused to meet them. That is so shameful. He could meet them and negotiate, but by not meeting, how can you negotiate?
So how much disruption are you expecting over the next 4 days, and what's it going to mean for patients?
Well, we have caring, sensible, sensitive doctors and nurses in our NHS, and arrangements have been made to not harm anyone and to provide a care that is as best as possible. Now, people will say, but it is still outrageous to strike. I say, on the other hand, if you don't take action now, you will have fewer doctors and you will have more deaths going forward. So this strike is actually something that really has to be addressed, i.e. grasp the nettle and sort the problem out. Otherwise, long term, we will definitely have many more deaths which could have been prevented.
And we know that one of the things junior doctors are asking for is better patient safety. It's clearly a very emotional issue. Many doctors like yourselves, very emotionally invested in this. Do you think the government will be persuaded to come to some kind of compromise?
They have to, because it is in their interest, it is in the interest of the nation. The National Health Service can deliver. We are a G7 nation. We have got the money. The big issue is how you choose to spend the money. Do you protect the ill, the vulnerable, the needy, or do you give tax breaks to the rich who can already afford private healthcare? So look, have a look at this. The Chancellor of the Exchequer gave tax breaks to the highest earners to top up their pensions. Poor people do not even know what a £1 million pension looks like, and they do not even know that they are being taken for a ride. This is not the way to look after a small segment of the country and set aside a large segment who can't afford to pay their bills or are not paid adequately. Health, education, nurses, and the list is getting longer every day.
You make some good points, Doctor. Thank you very much indeed for joining us. Dr. Bharat Pankhania there.